Autism Spectrum Disorder (ASD) is a neurodevelopmental disorder characterized by a range of symptoms and challenges that affect social communication, behavior, and sensory processing. The term spectrum reflects the wide variation in challenges and strengths that individuals with ASD may have. Here are some common symptoms associated with ASD. Social communication challenges. Difficulty with social interaction. Individuals with ASD may have difficulty with social interactions, such as making eye contact, understanding and using nonverbal cues, facial expressions, gestures, and developing peer relationships. Limited use of gestures and facial expressions, a lack of or limited use of gestures, facial expressions, and body language in communication. Difficulty with empathy, challenges in understanding and responding to the emotions of others. Repetitive behaviors and restricted interests. Repetitive movements or speech, engaging in repetitive behaviors such as hand flapping, rocking, or repeating words or phrases echolalia. Intense focus on specific topics, developing intense and focused interests in specific topics, often to the exclusion of other activities or interests. Rigidity in routine, a strong preference for routines and difficulty adapting to changes in schedule or routine. Sensory sensitivities. Heightened or reduced sensitivity to sensory stimuli. Individuals with ASD may be hypersensitive or hypersensitive to sensory stimuli such as lights, sounds, textures, or smells. Unusual responses to pain or temperature, reacting differently to pain or temperature changes than others. Communication challenges. Delayed or absent speech. Some individuals with ASD may have delayed language development or may not develop spoken language. Echolalia, repeating words or phrases without apparent understanding. Social challenges. Difficulty understanding social cues, challenges in understanding and interpreting social cues, which may result in difficulty making friends or engaging in age-appropriate social activities. Intense focus. Narrow interests and intense focus on specific topics or activities, often to the exclusion of others.